Welcome to the IAPB iHealth and COVID-19 web series, where we invite experts from across different areas of health and development to discuss key issues during the pandemic. Today's interview is part of a series of discussions to understand the way organisations are responding to the challenges in operating during the pandemic and adjusting to the new normal. I'm delighted to be joined today by Mike Hodin, CEO of the Global Coalition on Aging, which is the leading business voice on aging-related policy and strategy. Mike is a fellow at Oxford University, a member of the Council on Foreign Relations, and a managing partner at High Lantern Group. He has spoken on the topic of aging all around the world, including at the G20 and Davos, so we're very pleased he's agreed to share his thoughts with us today. Welcome, Mike.
Thank you, Jessica. Delighted to be here, and a pleasure for Global Coalition on Aging to be partnering with IAPB. Thank you.
Thank you. So, Mike, we've all had to adapt our organisational priorities during the pandemic. What changes has the Global Coalition on Aging made over the last few months?
Well, thank you for putting it that way. And the short answer is yes, we've been adapting and adopting new kind of practices and approaches. Living through a pandemic is a great challenge for all of us, both personally, family-wise, professionally, and for the community. From a Global Coalition point of view, if anything, the major space in which we're involved, that is to say, the aging of society, longevity, the different proportion of old to young in every society as it modernizes, is even more on the front lines as a result of COVID-19. Because as we know, the older population is among those at greatest risk. We've seen very tragically and unfortunately suffering and even death, tragedies with families and all across society. So we've been trying to address that from a Global Coalition point of view and work with all of our businesses cross-sector, our technology companies who are very much involved in telehealth and telemedicine, which is exploding, our healthcare and pharma companies that are really at the front end of innovations related to therapies, vaccines, and including on vision health, of course. Our financial services companies who are working with all of their customers and clients on a new way of work using online and virtual. And our home care, elder home care, home instead senior care, Omaha-based global elder home care company who is on the front lines hourly and daily. So thank you for asking, and yes, it's been a very challenging time for all of us, but we hope that maybe we're moving into a different phase in this terrible pandemic crisis.
Thank you, Mike. So it sounds like it's been a very busy time for you. I mean, you mentioned there obviously the particularly high risks for older people from COVID-19, but also the wider implications that it has, the change of care and support for older people, their ability to stay, socially connected, and even how they're being perceived within societies. And you've talked about some of the work that your organisation is doing. I wondered if you wanted to elaborate that, but also talk about some of the other global bodies and what they're doing to address the impact of COVID-19 on older persons.
Yes, well, Jessica, you're exactly right. And COVID-19, of course, hits us, not that any of us were able to choose, but it hits us in many ways inauspiciously just at the moment when we are launching the Decade of Healthy Aging. The World Health Organization and the UN generally have been working on initially a major report around healthy and active aging that led to a very significant and profound strategy, which was fully adopted by the executive board of the World Health Organization at their meeting in early February. And almost exactly at that moment, the COVID-19 pandemic erupted for all of us to experience, to be part of, to see. We all, of course, now know that it was with us for weeks or months before that, but it was really at that moment. So a few of the organizations that we work with very closely, one of them is the World Health Organization. And although we are still launching the Decade of Healthy Aging, it's at a moment when everything is through the screen or the prism, shall we say, of COVID-19. The needs for a healthier and more active aging is even more dramatic, however. I think we know the data points within the next couple of decades, there will be 2 billion of us on the planet over 60. But even more profoundly impactful is the proportion of old to young across every society as it modernizes. Countries like Japan, South Korea, China in a different way, virtually all European countries across from Finland to Germany, Italy, have already societies that have a greater proportion of old than young. And therefore, it's not just a matter of how do we treat people over 50, over 60, how do we enable and ensure a healthier and more active aging. It's also the public policy challenge that if we don't get it right, it has not only health impact, but economic and fiscal impact. And of course, Jessica, our partnership with IAPB, we know this more than ever in the vision space, where at the WHO, there's also the World Vision Report that is launching this year, because it's recognized that not only with respect to healthy aging, but with respect to active aging, vision health is really at the center. We know that we're no longer at a place where, well, she's 78 or he's 83, and that's what happens when they get into their 70s or 80s. Vision deteriorates. No, they have age-related macular degeneration or other retinal conditions or diseases. And we know there are things we can do about it, and we have to start doing that earlier in life to have a healthier aging. And there are things we can do as we get older as well. So it comes exactly at this moment when the World Health Organization is obviously near 100% occupied or preoccupied with COVID-19, that we're launching both the Decade of Healthy Aging and the World Vision Report. Similarly, in organizations like the OECD now has a major theme of theirs is aging societies. And it's that relationship between healthy aging and economic growth, even fiscal sustainability, where again, vision health plays a critical role, because it's not only an enabler for a healthier aging, but it's an enabler for what we all want, to be able to remain active as we age into our 70s through to our 90s, keep working as much as one wants to and one can. So the idea of vision health related to healthy aging is absolutely central. Organizations from the WHO to the OECD, we mentioned the G20, have all begun to recognize that. That's a good thing. And now we have to operate through the lens of COVID-19 as the pandemic that's having such influential shaping of our world.
Thank you, Mike. And I couldn't agree more. I mean, vision and aging is so important, not just, during the pandemic and as we emerge, but also, as part of the framework for recovery. So I agree wholeheartedly with everything that you have just said. Perhaps a more practical question, I know, because as you mentioned, we had also been pursuing activity within the World Health Organization, and similarly had our resolution on the World Report on Vision approved at the Executive Board. but quite rightly, the World Health Assembly focused on COVID-19, and so that's been delayed. Is that the same for the decade of healthy aging? Do you know when it's due to be adopted?
Very good question. We understand that both the World Vision Report and the Decade of Healthy Aging Report, which is the basis, or the strategy, which is the basis for the decade launch, is still on track. The official moment when the executive board's decisions on both topics were to be formally adopted at the World Health Assembly itself, normally held sometime in mid-May in person in Geneva. It did not happen. It was instead, as we all know, a virtual meeting dedicated 100% to COVID-19. But we understand that there will be additional sessions taking place in the fall. Whether that will be in person or virtual is still to be determined. And we understand from the Decade of Healthy Aging that still October 1st, which is formally the UN Day of Older Persons, will be when the Decade of Healthy Aging officially is launched. And as you alluded, just to show the recognition and importance of this, while it started out several years ago as a project of the World Health Organization, it will be adopted as a global project of the UN in the context of its Sustainable Development Goals, particularly with respect to health, which is SDG 3, but other elements as well. And I am confident that along with that, we will have the adoption of the World Vision Report. And so together, IAPB and Global Coalition on Aging can still work with organizations like the World Health Organization, OECD, G20, APEC, across the EU, to be able to ensure that we use those levers for continued advances in vision health, even as we age.
Thank you, Mike. So the COVID-19 pandemic is having, as you know, profound repercussions for health delivery. What do you see as the impact of the delivery of health services, and I guess particularly eye health services, for older persons during the COVID-19 pandemic?
Yeah, so it's a great question, and unfortunately has real consequences. I'm unfortunately confident, many of which we're barely beginning to fully understand and see. But vision health is a good example, unfortunately, of what we're referring to as the unintended health consequences of COVID-19, which is to say, as we're all staying at home, well, perhaps not all of us, but many of us are staying at home, particularly older citizens around the world, from the United States to Japan, in Brazil and India, across Europe. Being at home, combined with both advice not to go into hospitals or doctor's offices or clinics unless it's absolutely essential on an emergency basis related mainly to COVID-19, means that we're seeing that people are not receiving treatments. They're also not getting references to earlier, better monitoring, therefore earlier detection, diagnosis, which then can lead to treatment. Again, in the case of age-related macular degeneration, as we know, treatments are around injection, which, by the way, needs a great deal of innovation to move from just injection to other pieces. But right now, that is principally our solution to it. And if you're, a 74 or 82-year-old in particular, you're not getting your injection. And so we won't know the full impact of the consequences, for example, on vision health, both with respect to those who should have a diagnosis and haven't gotten it, or will get it 3, 4, or 5 months later than they might have, and for those who are not getting treatment for a period of time. I think that's beginning to open up, thankfully and hopefully. But we're also seeing impacts on, with respect to social isolation and frailty. One can only imagine the challenges of a 76 or an 82-year-old at home with care, without care, elder caregivers, with family, without family. In urban centers in particular, experiencing social isolation, the impact on perhaps emotional and mental health, not getting the treatment. Again, we gave the example of retinal conditions, macular degeneration in particular. These are all great challenges, and as we're describing, and many others are alluding to, unintended health consequences of COVID-19. There are some good things that maybe we can talk about that are coming out of COVID-19, like the explosion of the use of telehealth and telemedicine. But its adverse consequences, not only on health, on quality of care, on families, but I think we're only beginning to assess the budget consequences, individual budget as well as state, in the case of the United States, or regional or national budgets, because of the effects down the road on trying to make amends for these gaps that we're now experiencing.
Thank you, Mike. And I think, a lot of these challenges, we recognize from both the vision and the aging community. Certainly, the points that you mentioned around social isolation, lockdowns and physical distancing, have profound implications, not just for older persons, but also for people who are blind and visually impaired. I wonder whether you see a role for, I guess, eye health organizations and the aging community to work together in this effort, and what we might do.
Yes, it's a very good point. And as we look at the situation, some of the data that we have, you probably have more data around the world. We're based in New York, even though we're a global organization, so based in the United States. We understand that roughly 42% of patients surveyed in the US have reported reduced injections, for example, as the single greatest or most desirable improvement in their treatment regimen. So, the numbers are high, and they're probably underreported and understated, which is often the case. The impact on diabetic retinopathy, is, again, we know where it's put off recognition, put off diagnosis, therefore put off treatment. Nevertheless, we continue to work together, as you say, on enabling the kind of treatment that one can have, trying to prepare for this moment, which many of us are beginning to come out of. I know in many countries around Europe, you've begun to open up again. We in the United States have begun that. It's perhaps different in Kansas than it might be in New York City, but we're moving across a large continent. Japan is another interesting place. China, we understand there's some good reporting out of there, and South Korea is another good example. We have undertook an interesting project that we're just beginning work on, and look forward to collaborating and partnering with IAPB, a scorecard of where governments are with respect to the public policy world. Will no doubt bring in how we're doing with respect to COVID-19, generally where the challenges and opportunities are, where the barriers have been, where we can build incentives, both for current treatment, better diagnosis, current treatment, but also for supporting future innovation. And that's underway. So, you know, we all are working as we are today, even virtually. We're very excited about this new Global Coalition on Aging project on this scorecard to undertake where governments' public policies are and how we can use that maybe to help push it along a little bit over time. So, you know, there's a lot going on. We met not too long ago. It seems like a decade ago. I think it was only about 7 or 8 months ago in Brussels. And, you know, working on how we can collaborate, particularly around the EU. So, yes, there's a lot going on, a lot of opportunity. And we think this intersection of the megatrend of aging and the huge challenges around vision health are ones that are so critical, not only for a healthy aging, but for an active aging.
Thank you, Mike. And perhaps you've stolen the thunder out of my last question, because I was going to mention, you know, you've obviously had a strategic focus on vision now for some time. And I know that because I've been invited to numerous aging and eye health related activities that you've done, certainly since I've been in post at IAPB. I mentioned the Brussels meeting, but also your tremendous conference that you organised in Finland back at the time when we could all get in a big conference hall together. And, you know, you also hosted a tremendous dinner, I know, at the UN, which, you know, was very well received by our UN Friends of Vision group. I suppose I just wanted to ask, you talk about the scorecard, which I think is a fantastic initiative, you know, whether there's anything else that you wanted to update IAPB members or the eye care sector on in terms of your plans for 2020.
Well, thank you for referring to those activities that we have undertaken over the last 2 or 3 years in particular, excuse me, and collaborating with IAPB on many of them. The Silver Economy Forum in Helsinki was a great event. It was the first ever global event jointly sponsored or partnered between the Global Coalition on Aging on the business side and the Finnish government on the government side, purposely done at the moment when the Finns were picking up the EU presidency last July, which of course lasted for 6 months, and they had aging as their major theme. But we were very pleased to have global representation from across business and across sectors. Vision health was clearly on the agenda, very prominently so. But we also had topics from elder caregiving to issues around vaccination, particularly adult vaccination, reframing work in an aging world where we hope there's the opportunity for people to keep working if they want to and can. So it was a very good event. We're planning, we had planned a Silver Economy Forum 2020 in China. That's still will be underway, we expect, but now will be virtual. We've already discussed with other across Europe virtual settings like that. Having some work with the OECD as well, and I know the OECD saw what we did at the UN on the Dine in the Dark and was very interested in a Dine in the Dark session, perhaps related to their business forum. That now will all be virtual, so I'm not sure we can do that virtually, but maybe in 2021 with the OECD, we would hope to have some work with them. And we've had these roundtables that have been very interesting. We did one at the global level, right down the street from the UN, actually, in New York, near our offices about 2 years ago. Might even be 3 at this point. Who can keep track of time? But it really launched our kind of work at this intersection of aging and vision health. And now having activities, as you say, with you in Europe. We had a very nice roundtable on Capitol Hill in the United States, where we're very delighted to be joined by and really led by there's a Congressional Vision Caucus. And so we were very delighted to work with the Vision Caucus. We worked directly in the United States to prevent blindness on the vision side, and then Geriatric Society of America on the aging side. And we will have ongoing work in that arena. We have a few issue briefs that came out of that on policy recommendations around reimbursement, around advocacy, and again, to highlight perhaps the most important kind of, I'll call it sociological and cultural shift, which goes through all of this and is global. And that is through the prism of ageism to reinvent, rethink, and reframe vision as we age. Namely, that it doesn't have to be. It may be, and if it is, there's much that can be enabled and much that can be supported. But many of the conditions of aging, from hearing to vision, bladder health, skin deterioration, NCDs generally, from diabetes to cardiovascular, etc. We're in a different world today, where we have therapeutic advances, we have possibilities on the health side, and again, because of the numbers, 2 billion of us on the planet over 60 in a couple of decades, more old than young in every society across the globe, means that we can no longer afford to think of these things such as vision deterioration as we age as a normal part of aging. It doesn't have to be. And in many cases, it should not be. I think we have a notion that the global burden of age-related macular degeneration is expected to double by 2040. Expected to double. Maybe we can make a dent on how that happens, and even as it does, to manage it in a way so that people can still have quality of life and reduce spending in a way that we'd all want. So I think we are at a very important inflection moment, and we'll use both the Decade of Healthy Aging and the World Vision Report as pillars to drive this forward. And thank you again for your partnership and collaboration, IAPB, with Global Coalition on Aging.
Thank you, Mike. And I think I'd like to say, on behalf of IAPB, but also, the eye care sector, thank you for all your thought leadership on this and for really integrating vision into your program of work. You've just had some great initiatives over the next year, and I look forward to working with you over the years to come, and I look forward to joining the virtual conference in China. It's a pity that I can't be there, or none of us can be there in person. I think this brings us to the end of the session today. I'd just like to thank you, Mike, for sharing all of your insights with us. It's been really interesting to hear your thoughts on this topic. Thank you also to all of those of you who are watching this. We hope you found this useful. And as I mentioned at the beginning, we have more interviews and recorded webinars available on our website and social media channels. You can also find further upcoming webinars, resources and articles on our COVID-19 resource page. Thank you very much.